My name is Dr. Edward Brown. I'm a second-generation orthodontist from the coast of Louisiana and practiced in Louisiana and Mississippi Gulf Coast. Did my undergraduate training at University of Virginia, followed with dental school at LSU, and then orthodontic training at St. Louis University. I've been in clinical practice for over 20 years, and I'm really passionate about orthodontics because it gives us the opportunity to impact people in just such a manner that it restores self-confidence and puts them in a position to be more successful and have more, more self-confidence, I guess. But and you know, there's only two parts of your body that reflect light: your eyes and your teeth, and that's what people are drawn to, and is what makes people so engaging. And when you have that great smile and those beautiful straight white teeth that people are drawn to, it's that gateway to the soul. And in my training and in my years of clinical practice, I've kind of honed in on what works best for me. I do not take out teeth very often, but when it's warranted, we will. I do believe in early intervention, not necessarily early treatment. We like to see children at the age of 7 to develop a baseline and see if we can identify any potential pitfalls down the road that'll make the orthodontic treatment much more difficult, such as impacted teeth, missing teeth, growth issues, airway issues are very big, thumb habits, any type of tongue postural habits that can create negative pressure and basically cause the bite to be more difficult to fix. In identifying those, if they are warranted to treat, we will treat them. We do some early interceptive treatment, but keep it at a minimum so as not to burn the child out. I do a lot of Invisalign and aligner therapy. It's great for adults and busy professionals and busy people where they don't have to come into the office as frequently, and we can monitor them from afar using dental monitoring, where in theory they don't have to come in at all once we've delivered their aligners, unless their attachments fall off or they have concerns. We need to make corrections and whatnot. For children and while they're growing that have significant skeletal issues, we use a lot of functional appliances. And one technique that I'm very passionate about is something called MEOW, which is an acronym for multi-loop edgewise arch wire, MEAW. And it's a custom built or formed wire that I bend myself, and it's to help with people who have bad underbites and open bites where their top and bottom teeth don't touch. And that technique, when the patient is compliant with the elastic wear, really alleviates the need for surgery in many, many, many cases. So it's been a real boon to me, and it's a great tool in my toolbox that I've had in my arsenal now for about 3 or 4 years, and has really helped me develop a greater handle on those types of cases, with much greater success and less stress for me and the patient, especially those who are fearful of surgery and the inability to take that treatment path. I had the benefit of growing up as the child of an orthodontist, and at an early age, my dad drugged me to work. From the age of 10 or 11, I was in his lab, pouring up models, working and trying to learn how to make retainers. And this is many, many moons ago. And retrospectively, seeing what I would do when I was goofing off in the lab and not doing what I was supposed to do, I would take old models and I would cut holes in the surfaces of teeth and then fill them with wax, pretending I was a dentist. So I kind of had an affinity towards that. I've always been I've always been more interested in working with my hands. Legos were my favorite toy as a child, and I still do Legos with my kids to this day. And because the spatial relations and moving things around, the creativity and the satisfaction of starting from something and getting to the end it's just a great satisfaction, which is similar to orthodontics. You start with something that looks like a jumbled mess, for lack of a better term, and you've got this vision of what it should be, and you work to that end, and it's a progression, and it's very satisfying. And working in my dad's office many, many years ago, you know, nobody was upset. There wasn't any tears. There wasn't any blood. No pathology. It's clean. It's happy. People want to see you. And in the field of dentistry, it's really the only, well, not the only, but it's the most readily available way to impact people positively with a non-surgical, non-invasive, so to speak, and non-painful experience. And the lifestyle is one where we don't have a whole lot of emergencies. We can engineer as much free time as we would like. we get the opportunity to interact well with parents and children, and these people become part of a family over time. And like, I have 3 children of my own, with the hope that 1, 2, or all of them follow in my footsteps. And I have a sister who's an orthodontist, and you'll meet her shortly. And she has 3 kids, and we just have made this kind of a family affair over the past almost 50 years. So we hope to keep it going another 50.